you have joined Caring on the Crossroads of Indiana, the Critical Access Hospital Convening meeting, and this is our fall event. Want to thank Carolyn Miller with IRHA and Ali Orwig for supporting Zoom today. If you have any questions, feel free to email me or chat into Ali if you're having trouble unmuting or hearing, or to Carolyn, and they'll be glad to assist you with Zoom. We do ask that you do use the chat function today to chat in any questions you have for each of the presentations. And you can do that by hovering at the bottom of the Zoom screen, and you will see a chat function that you will be able to click. I encourage you to do that, as you can watch comments come in through the day and watch chat for questions and any types of updates along the way. Also encourage you to feel free to unmute your line to ask any questions during the presentation. Again, hover at the bottom and you will see the microphone there. Or if you've opened up the participant list by clicking on that participant list icon, you can also unmute by clicking on the microphone beside your name. Again, presentations were emailed yesterday. The COVID update will be provided when we send out the recordings of the event, and you'll be able to look at it then. There were still updates being made to that particular presentation late last night. If you didn't receive any of the presentations, email me at broyer@ihaconnect.org, and I will send those out to you. Please feel free to stay connected throughout the day. And again, sit back, relax, and enjoy the day. Brent Anderson, practice coach from the Indiana Department of Health, will take a few minutes at the beginning of each break to do some wellness types of activities briefly to help you enjoy. So at this time, I'm going to turn it over to Karen Kennedy.
Thank you, Becky, and thank you everyone for joining us. I'm excited to hear Brent Anderson lead us through those exercises. So I think that's going to be a great addition to today's meeting. So I'm really pleased to see we have over 50 participants today. So thank you for taking your time to be with us today. I know it's been a very, very stressful time for each and every one of you. So I'm just thrilled that so many of you were able to join us today. I'm Karen Kennedy, and I serve as Vice President of Quality and Patient Safety at the Indiana Hospital Association, and IHA is one of the partners today, bringing on, hosting this meeting today. Additionally, the Indiana Department of Health, the Office of Rural Health, is joining us today. The Indiana Department of Health Epidemiology Resource Center is one of our partners as well. QSource is one of our partners, as well as the Indiana Rural Health Association. So again, thank you so much for joining us today. And at this time, I'm going to turn it over to Phil Ellis just to say a few words and welcome, have a little welcome from the Indiana Rural Health Association as well. So Phil.
Great, thank you very much, Karen. My name is Phil Ellis. I'm the Network Director and Senior Director at the Indiana Rural Health Association. Kara Veal normally does the welcome on behalf of IRHA, but she was unable to join us today. But I look forward to being here and joining all of you today. I certainly look forward to when we're able to get back together in person for live on-site events. But I certainly want to acknowledge Rebecca and Karen and everyone that puts these meetings on, and their ability to do such a great job converting these to virtual. IRHA has 28 rural hospitals as members. Most of those are critical access hospitals, and I know these events are very meaningful to them. So I hope everybody can sit back and enjoy the meeting today, and I will see you later when we do a session on security with Randy Colentus from Reed Health.
Thank you so much, Phil. So I'm going to run through some partner updates before we get started. We do have the 2020 Critical Access Hospital Award winners. And so acknowledging the critical access hospital winners from last year. These were awards that were provided by the Indiana Department of Health, State Office of Rural Health. So the Innovation and Quality Award is Perry County Memorial Hospital. The Community Impact Awards go to Cameron Memorial Hospital and Decatur County Memorial Hospital. And the Outstanding Rural Health Partner is Matt Weber, who is a pharmacist at Decatur County Memorial Hospital. And the Outstanding Critical Access Hospital Leadership Award goes to Mary Drews at IU Health White Hospital. So congratulations to all these Critical Access Hospital Award winners. So just wow, just what a tribute to you and receiving these. And I know you do great work, and really grateful that you're a part of the what I like to refer to as Team Indiana. So very grateful for you, and thank you so much. Here we have a listing, and yes, and thank you to David Conrad. There will be more going on later today regarding these awards too. That is actually part of the agenda. So, but just wanted to run through that quickly. Here we have Tina Feaster's team. I know Tina's had a few changes at the Indiana Department of Health and the Epidemiology Resource Center. So thank you, Tina, for providing this organizational chart. I think that's so very important to know who the contacts are. Looks like you have just a couple of open positions. So hopefully you will have a full team soon. So always so grateful for Tina and the great work that she does. Here, the Healthcare Associated Infections and Antimicrobial Resistance webinar for hospital infection preventionists. Make sure you have this on your radar screen. Two upcoming webinars, October 26th and February 22nd. Those were actually passed, but I know the webinar, those are usually recorded. So keep a lookout for that one on November 30th. Is that actually supposed to be 2022 by chance, maybe, Becky? Or do you know?
It could be. It's
okay.
Tina's slide, but I bet it means 2022.
Okay. Just notice that. And then moving on to the next slide, Allie. So the Indiana Hospital Association, we have created the COVID vaccine acceptance toolkit. That is actually in conjunction with Cynosure Health. And so the webinar, the link to that toolkit is here on your screen, and you have those when you look at the slides as well that are sent to you. Be sure to tune in, especially for the birthing hospitals. Actually tomorrow, October 20th from 3 to 4, we will be hosting the 2021 Inspire Hospital of Distinction Awards. So birthing hospitals will be receiving their maternal and infant safety awards. So it'll be a great virtual celebration. If you weren't able to tune into IHA's sepsis awareness education, we had several webinars, and we still have one more webinar coming up, which is November 16th, where we will look at the sepsis discovery tools. And some great pictures from sepsis awareness in action. I just want to point out Harrison County here, one of our critical access hospitals participating in Sepsis Awareness Month. And the Medicare Beneficiary Quality Improvement Project, the MBQIP Swing Bed Educational Webinars are hosted on the second Tuesday of every month at noon Eastern Time, 45 minutes. So the dates are listed here for you to get those on your calendar. And the MBQIP Flex Quality Networking meeting is the last Tuesday of every month at 11 Eastern. So the next one will be November 23rd. Be sure to register for the upcoming virtual fall forum and the National Rural Health Day, which is hosted by the Indiana Rural Rural Health Association. Engage with the Indiana Rural Health Association for this day. Just a couple of things to point out for this meeting. Student memberships are free. There is a nominal membership fee for this event. This is always a great day, and one of the meetings that IRHA hosts every year. But really more importantly for this day is that the IRHA will be celebrating National Rural Health Day on November 18th. Also, be sure to check out IRHA's new IRHA Help connecting people and programs. There's actually the barcode that you can scan to actually access that URL, which I love seeing now. That's something IHA has started doing too, is that being able to scan that from your phone to access important information quickly. Here you can find resources on food, transportation, education, health, housing, and work. So be sure to check out this new tool that has been brought to you by IRHA. Again, National Rural Health Day is November 18th. You can link to powerofrural.org to learn about National Rural Health Day and the power of rural. If you have any questions, feel free to reach out to Joyce Fillenworth at the Indiana Department of Health, State Office of Rural Health. I know that this has been a day that's really, since Joyce has been at the Office of Rural Health, has really been trying to kind of lift this day up and really promote it more. So thank you, Joyce, for helping to celebrate the power of rural. So again, save that day. They're actually, so I guess again, another thing on this day is to get out your camera and capture your best rural health photo. And you can submit that rural health photo to IRHA for a chance to receive a complimentary registration for the 2022 IRHA annual conference. So I love this idea. I think this is great. I'm looking forward to actually seeing the photos that are taken. So be sure and get involved in this National Rural Health Day photo contest. And the upcoming Q-Source office hours are on, it's on October 27th, 2 p.m. Eastern time. The Indiana Department of Health and a medical director will be available to share an update on COVID-19 and in our state, as well as hold an open forum for questions. So we'll be looking at the Delta variant statistics and the impact of children, the COVID-19 booster eligibility, looking at influenza and pneumonia and the state level vaccination rates. And please stay tuned for the next date for the spring CAH meeting. And as it's noted here, hopefully we will be in person. But I just really do want to thank Becky Royer for everything she has done to, we're going to plan this in person, and then we have to make that switch quickly. So we're just so thrilled again to have you here virtually.